Are mad people just too bloody pathetic to be told the truth? 30 people were interviewed, 4 knew of the HoNOS, none had ever had any discussion with a clinician about the HoNOS. In a way, we're not talking about the HoNOS, we're talking about a summary of the assessment, and we're not talking about just the assessment, we're talking about the sharing of pertinent information. Surely anything that generates conversation, open conversation, even debate between the clinician and the client is a good thing.
I first heard about the HoNOS when my nurse mentioned it, told me what we were doing, and that it was ratings to do with mental health. Before I knew what it was all about, I just thought it was just questions you had to answer to make everyone happy. Going through the HoNOS, it gave me 3 months to either improve, either come down or go up to where I thought I should be.
I think that one of the most important goals in changing New Zealand services is to restore to the consumer the belief that he or she can and should be in charge of his or her own recovery.
I could see myself going up and I can see myself coming down. But on the downs I was prepared for better things to come. Going through with Julie on all those 12 different things, each issue had a conversation point where we actually talked about drug and alcohol, say.
It's about really honouring that you hold people's information about their very personal lives in your hands, and you have a responsibility to do something great with that.
We went over from when we first started, and the improvement that I've actually made personally, I'm on medication, but 90% of the improvement I made myself. There were a few times when we disagreed and I just said it was all bullshit, and she just laughed, and we went over it, and we resolved, and then we came to a mutual understanding that this is probably better, and it worked out all right. At the times we done it, she'd always have the computer there, and she would write down what I thought on the computer and just leave it there for us to go back when we'd done it the following 3 months. I felt we had gone somewhere in that 3 months, just on those ratings that you have, and, you know, things about your daily living and your social life, and I felt as though something was actually being done for me. She was open, frank and trustworthy. She was what I think a mental health key worker should be, and it basically came from the HoNOS that she told me about it, and that brought us closer together, and we actually look forward to our meetings every 3 months.
I really would hope that we actually have information that's useful to service users that they can use to monitor their own journey of recovery.
After 15 years, and it was only 5 years ago that I first done the HoNOS, I felt that there was something that had my input in.
Consumers kind of get the message that the outcome measures aren't important because they're never discussed.
Well, apparently I've got 28 files, but I don't know anything that's written in them. But the clinicians don't. They don't tell you what it's about, they don't tell you what it's for, they don't tell you about the ratings.
Quite a lot of time we forget to give all the information that we gain to the person at the centre of it all.
Information is an incredibly empowering thing. Service users, by having easy access to all kinds of information, particularly through internet, you know, are more empowered to kind of question what's going on, to maybe take more control over their lives.
What they do with it, I don't know, but it gives me as a consumer, as a tangata whaiora, somewhere to aim. It just made me aware that there are people looking out for my health and well-being.